With vaccinations finally ramping up across the country, there's a clear divide between suburbs on who has and who hasn't had the jab. We've crunched the numbers.
Just go and do it. Go and do it.
Everybody's talking about vaccination.
I'm not in no hurry at the moment to get the vaccination.
But new data now shows who's getting the message. Vaccination rates by suburb, revealing who's rolling up their sleeves and who needs more support.
Richer areas, broadly speaking, have a higher uptake than poorer areas.
In our biggest cities, the lowest percentage of fully vaccinated people can be found in the southwest region of Sydney, from Lakemba to Liverpool, where data shows just 17.9% are fully vaccinated. In Melbourne, the northwest region, from Broadmeadows up to Kilmore, records a 17.7% vaccination rate, with both areas slightly below the national average of 18%.
The areas with a lower uptake of the vaccine have lower rates of English as a first language, but I don't think necessarily that this is the main reason for the lower vaccination rates.
Demographer Simon Kuchenmacher is from the demographics group. According to Simon, stats show that areas in Sydney and Melbourne with a low vaccine uptake have increased numbers of large-scale multi-generational families. He argues recent lockdown rules limiting family meetings has created resentment towards government messages, including around vaccination.
I do think it has more to do with the general attitude towards government, a general mistrust.
In Broadmeadows, in Melbourne's northwest, we asked why local vax rates were lower than average.
Because there's too many idiots living here.
Because you come in here, sometimes you're supposed to wear masks. A lot of times people haven't got masks on and you feel like just run up and whacking them and tell them to put their mask on.
Brisbane's southern suburbs has recorded 41.1% of people receiving their first dose, but it still trails other parts of the city in that area, including Brisbane's west, taking in the Enoggera Barracks, which has recorded an above-average 49.3% first dose rate.
Well, in the last 7 days alone, over 1.33 million Australians, or almost the entire population of Adelaide, have come forward to be vaccinated.
Federal Health Minister Greg Hunt says the government is paying special attention to areas with low vaccination rates.
We're working with community leaders in terms of different cultural backgrounds, different linguistic backgrounds. We're also providing materials in multiple languages in those different communities.
The best vaccination rates in our capital cities can be found in North Sydney, where more than half of residents have had their first jab and 32% are fully vaccinated. Melbourne's inner south records 51.4% of residents taking their first dose, while the regional centres of Bendigo and Geelong have both recorded more than 50% of people taking a first dose and more than 25% fully vaccinated. Launceston has a strong take-up with a 52.4% first dose rate and 30.8% of locals fully vaccinated, while Darwin has an above average rate of 27.3% fully vaccinated, slightly ahead of South Australia's highest result, 26.1% in the southern suburbs of Adelaide. On the bottom of the table, outback Western Australia, where just 9.9% of the population has been fully vaccinated. Low uptake risks wasted vaccine.
If you don't use the 10 doses in 2 days, then you have to throw the remainder out.
Dr. William Fung is a GP in regional Victoria who recently had to dispose of unused vials.
I guess it makes me feel pretty angry because, and frustrated because, you know, the world's got a vaccine shortage.
The United Arab Emirates boasts the best vaccination record on earth, with 81% of its 9.7 million residents having had their first dose. The UK sits 15th, with 70% first dose rates and 59% of the population fully vaccinated. Australia, with just 36% first dose rate and 18% of Aussies fully vaccinated, has us ranked at a lowly 73rd worldwide. Data analyst Anthony McCarley lobbied the government to have geographic vaccination rates released.
It just really helps drive the discussion on, how can we prevent outbreaks in the future?
But McCarley says there's more data we need to better measure the impact of vaccination. He wants to see the government publish whether people in hospital with COVID have had the jab or not.
that would tell us straight away, you know, has this vaccination stopped someone from getting seriously ill? And we do know they work, but I don't think we're seeing that data conveyed very well in this country.